So the major projects that we've got on at the moment are to develop patient records further. So we've got an individual health record which we've had for some years, and that is largely a copy of the GP systems that is made available in other care settings. But we are developing further systems now, particularly my focus has been, in my talk today, has been around the Welsh Care Record Service. And that's really expanding the use of the system to allow people to generate their own content and make that available within a searchable repository of data. Yeah. So I guess apps are a real buzzword at the moment, and a big technology has been used by lots of people in lots of different industries, and probably in health we've not been as good at utilising them as we might have been. And I think one of the key things for app development is having an information source that can be used, something that can be built upon. So I think we've got the building blocks in place and the systems in place that allow innovation through the production of apps. But I think there's a way to go to provide an environment where that can be where they can be developed in useful ways to generate content for the patient's record. I think that getting up-to-date information about what's going on in informatics is quite a challenge, particularly with the day job. We have got people in the organisation who spend quite a bit of their time looking at what the emerging technologies are, and I think we try and disseminate that through the organisation and indeed out into NHS Wales. But I think one of the challenges for us is how do you create room for innovation, because there's such a challenging agenda anyway that can fill the day, and you don't get a chance to have a look over the horizon to see what else can be done. So we always have a challenge to give enough space to some new thinking and new ways of working, and what is coming up over the horizon. So it is a challenge, and we try to do it by giving some people some time. I think that the key things for us over the next coming year are what I talked about today. Really, my talk was the Welsh Care Record Service. We really want to see that being operational. We want to see a lot of people using that service and starting to innovate with the tools and techniques that gives them. And the other big thing that we have happening is the community system which we've got with social care. So it's a jointly procured system. It allows community workers and people in local authorities to share the same information about the patient or the citizen, and share care plans, and that again becomes part of the NHS Wales architecture, and so we are looking forward to being able to use that information in a wider setting. Yeah. I think the patient experience of the NHS is probably different to most of their experience with any other organisations that they engage with, and that they are less able to make the choices or interact in a way that they can with other services. So I think the major changes that having more information around allows us to do is to open up some of those systems so that patients can interact directly with them, particularly around patient booking, being able to see the doctor in different ways than they currently can, and indeed having access to their own notes and the information about their care.